$293 million. That's the number federal prosecutors just slapped on two brothers from Naperville, Illinois. But here's what nobody's telling you about this case. This isn't just another Medicare fraud story. This is the anatomy of how criminals weaponized a pandemic, how they turned America's fear into their personal ATM machine, and how they almost got away with stealing more money than most people will see in 10 lifetimes. I'm going to show you exactly how Minhaj Faraz Mohammed and Sufyan Ferozi allegedly built a COVID testing empire that billed the federal government for tests that never happened on patients who didn't exist through laboratories that were nothing but paper shells. By minute 3, you'll see how they allegedly laundered $65 million in fraud proceeds into gold bars and overseas luxury mansions. By minute 7, I'm going to prove to you, with the government's own documents, why this case represents something far bigger than two guys from suburban Chicago. This is about a systemic vulnerability in our healthcare system that cost taxpayers $14.6 billion in 2024 alone. And the FBI and Department of Justice are terrified that Americans still don't understand how deep this rabbit hole goes. Let's dive in. December 5th, 2024, Federal Courthouse, Chicago, Illinois. Minhaj Faraz Mohammed, a 37-year-old resident of Naperville, walks into the Everett McKinley Dirksen United States Courthouse on South Dearborn Street. He's flanked by attorneys. His brother, 35-year-old Sufyan Feroz, is beside him. The building's granite facade towers above them, its Art Deco columns casting shadows across the plaza where FBI agents and federal prosecutors have been building their case for the past 2 years. Inside, a superseding indictment waits. 6 counts of healthcare fraud, 1 count of money laundering conspiracy. For Sufyan, there's an additional charge, engaging in monetary transactions using criminally derived property exceeding $10,000. The stakes are beyond comprehension. Each healthcare fraud count carries a maximum of 10 years in federal prison. The money laundering conspiracy charge could add 20 years. That's potentially 70 years for Mohammed, 80 for Feroz. But the numbers that matter most are written in black and white across the 30-page indictment the Department of Justice unsealed that day. $293 million in fraudulent claims, $65 million actually paid out by Medicare, Medicaid, and private insurers. 4 clinical laboratories in Illinois and California, allegedly controlled through straw owners, phantom operators whose names appeared on paperwork while the brothers allegedly pulled the strings behind the scenes. Acting Assistant Attorney General Matthew R. Galliotti stood before cameras and microphones that afternoon. His words were measured but sharp. These defendants are charged with a brazen scheme to steal nearly $300 million from vital healthcare programs by taking advantage of the fear and panic of the COVID-19 pandemic. FBI Special Agent Douglas S. DePodesta was more direct. The defendants chose to enrich themselves and deprive the most vulnerable members of society from much-needed assistance designed by the U.S. government to provide critical relief efforts. In the next 60 seconds, I'm going to show you exactly how federal investigators claim they did it. Picture this. March 2020, the world shuts down. COVID-19 is spreading across America like wildfire. Hospitals are overwhelmed. Testing sites can't keep up with demand. The federal government opens the floodgates on emergency funding. The Health Resources and Services Administration launches the COVID-19 uninsured program designed to reimburse healthcare providers for testing and treating people without insurance. Medicare expands coverage for COVID testing. Private insurers follow suit. Billions of dollars start flowing into the healthcare system. No questions asked. Speed is the priority. Get tests to Americans, save lives, process claims later. That's when Mohammed and Feroz allegedly saw their opportunity. According to the Justice Department, they established a network that prosecutors now call a fraud factory, FZ Medical Incorporated, operating as Next Labs Incorporated, multiple clinical laboratories across state lines. On paper, these labs look legitimate. They had licenses. They had laboratory directors whose names appeared on state filings. But federal investigators claim these directors were straw owners, figureheads who either didn't know what was really happening or who looked the other way while the brothers allegedly ran the operation. Here's how the scheme allegedly worked. The laboratories would submit claims to Medicare, Medicaid, and Blue Cross Blue Shield of Illinois. Claims for COVID-19 laboratory testing services, respiratory panel tests, PCR tests, antibody tests. The claims came with patient names, Medicare beneficiary identification numbers, dates of service, test results. Everything looked official. Everything appeared legitimate. The insurers processed the claims, they cut checks, they wired payments, millions of dollars flowing into accounts controlled by FZ Medical and Next Labs, more than $72 million in claims submitted to these insurers. Nearly $10 million paid out before the scheme unraveled. But here's what's crazy. According to federal prosecutors, the test never happened. The patients listed on those claims, many never submitted samples. Some never even knew their information was being used. Some didn't exist at all. The government alleges that Mohammed and Feroz were billing for COVID tests on phantom patients using stolen or fabricated patient information to generate fake claims. They allegedly created a paper trail of services that were never provided to beneficiaries who never received them. Think about the logistics of this operation. You're not talking about one or two fraudulent claims slipping through the system. You're talking about tens of thousands of claims, maybe hundreds of thousands, claims that needed patient identifiers, medical codes, provider information, dates of service, claims that had to be formatted correctly to pass through insurer payment systems. This wasn't amateur hour. This was allegedly an industrial scale operation designed to maximize fraudulent billing while minimizing the chances of getting caught. And for a while, it worked. The money poured in, but the government was watching. The Department of Health and Human Services Office of Inspector General has sophisticated data analytics systems designed to detect anomalies in billing patterns. They started seeing red flags. Labs billing for massive volumes of tests, but operating out of addresses that didn't match their claimed capacity. Claims for services in geographic areas where the labs had no physical presence. Patterns that didn't match legitimate laboratory operations. The FBI launched an investigation. Agents started pulling bank records, interviewing witnesses, executing search warrants. What they found, according to the indictment, was a money trail that led straight back to the brothers. But that was just the beginning. Because once you've stolen $65 million from the federal government, you face a different problem. How do you spend it without getting caught? Stay with me, because what I'm about to tell you about the money laundering operation is where this case goes from healthcare fraud to international criminal conspiracy. Why is this happening now? Why are we seeing this massive crackdown in December 2024, almost 5 years after COVID-19 first hit American shores? Because the Department of Justice has spent the last 4 years building the infrastructure to prosecute what Attorney General Pamela Bondi calls the largest healthcare fraud takedown in American history. On June 30th, 2025, the DOJ announced the results of the National Healthcare Fraud Takedown. Operation name, the 2025 National Healthcare Fraud Enforcement Action. 324 defendants charged across 50 federal districts, 96 doctors, nurse practitioners, pharmacists, and other licensed medical professionals. $14.6 billion in fraudulent claims. Read that number again, 14.6 billion with a B. That's not a typo. That's the largest single enforcement action in the history of the Criminal Division's Healthcare Fraud Unit. The Mohammed and Feroz case is part of this massive dragnet. But here's what makes this different from previous enforcement actions. The DOJ isn't just going after the fraud itself. They're targeting the entire ecosystem that made pandemic fraud possible. They're prosecuting the call centers in Pakistan that harvested Medicare beneficiary information. They're charging the straw owners who lent their names to fraudulent operations. They're seizing the assets purchased with fraud proceeds. $245 million in cash, luxury vehicles, cryptocurrency, gold bars, and real estate seized nationwide. Compare this to previous efforts. In 2024, the DOJ charged 193 defendants in pandemic-related fraud cases. In 2023, the numbers were even smaller, but 2025, this is the culmination of years of investigation, data analysis, and coordination between federal agencies. The FBI, HHS Office of Inspector General, Drug Enforcement Administration, Food and Drug Administration Office of Criminal Investigations, all working together under the Healthcare Fraud Strike Force. But here's where it gets controversial. Critics say the government moved too slowly. They point out that billions of dollars in fraudulent payments went out the door in 2020 and 2021, while federal agencies prioritize speed over verification. They argue that the very programs designed to help Americans during a pandemic created a criminal feeding frenzy. Healthcare fraud experts estimate that Medicare loses $60 billion annually to fraud, abuse, and billing errors. That's 3 to 10% of total healthcare expenditures disappearing into the pockets of criminals. The COVID-19 pandemic supercharged that problem. Is this legal? The prosecutions? Yes. Is it ethical that it took this long? That's the question Americans are asking. Is it working? I'm going to answer those questions. But first, you need to understand exactly how the money laundering operation worked. Pull up a map of the United States. Now look at Illinois, Naperville, a wealthy suburb 40 miles west of Chicago, median household income over $120,000, good schools, safe neighborhoods. This is where the Mohammed and Feroz allegedly lived while building their fraud empire. Now look at the four laboratories prosecutors say they controlled. FZ Medical Incorporated, also known as Next Labs, operating in Illinois. Additional clinical laboratories in California. These labs served as the front end of the operation, the legitimate looking businesses that submitted claims to insurers. But here's why this worked. Healthcare billing is incredibly complex. When a laboratory submits a claim to Medicare, that claim goes through multiple layers of processing. First, it hits Medicare's fiscal intermediary, a private company contracted to process claims. The intermediary checks the claim against a database of rules. Is the provider enrolled in Medicare? Is the service covered? Are the billing codes correct? If everything checks out, the claim gets paid. The money flows from the Medicare trust fund to the provider's bank account. Same process for Medicaid and private insurers. The system is designed for volume. Medicare processes over 1 billion claims annually. Speed matters. Detailed verification of every single claim is impossible. The system relies on spot checks, data analytics, and post-payment audits to catch fraud. That's the vulnerability. Criminals who understand the system can exploit the gap between payment and verification. They can flood the system with fraudulent claims, get paid quickly, and disappear before auditors catch up. But Mohammed and Feroz allegedly didn't disappear. They allegedly got greedy. According to prosecutors, they didn't just steal the money, they flaunted it. Luxury real estate developments overseas. Federal investigators don't specify which countries, but the indictment mentions luxury developments overseas purchased with fraud proceeds. Gold bars, physical gold, easy to transport, hard to trace, the classic tool of money launderers throughout history. Luxury watches, Rolex, Patek Philippe, Audemars Piguet, timepieces worth tens of thousands of dollars each, luxury vehicles, high-end cars that turn heads and signal wealth. But here's what they did that sealed their fate. They allegedly ran the fraud proceeds through a complex money laundering scheme. The government's indictment describes how they allegedly transferred money between the laboratories and other businesses they controlled. Shell companies, multiple bank accounts, transfers designed to obscure the source, location, ownership, and control of the funds. That's textbook money laundering. And that's why the money laundering conspiracy charge carries 20 years in federal prison. Because money laundering isn't just about hiding dirty money. It's about integrating criminal proceeds into the legitimate economy. It's about creating a false appearance of legality. It's about trying to enjoy the fruits of crime without facing the consequences. The government alleges that Mohammed and Feroz moved tens of millions of dollars through this network, $65 million paid out by insurers. Where did all that money go? Some of it went to gold and real estate, but the rest, federal investigators are still tracing the money, still identifying accounts, still working to seize assets before they disappear into offshore havens. And here's what they do next that most people don't know about. The government doesn't just prosecute the defendants. They go after every dollar. Here's what every healthcare fraud expert will tell you. They'll say, look, Medicare fraud is a cost of doing business. You can't eliminate it completely. The system is too big, too complex. 3 to 10% loss rate is actually pretty good considering the volume of claims. They're wrong, and I can prove it. Let's do the math. Medicare spending in 2024, over $900 billion. 3% fraud rate, that's $27 billion stolen from taxpayers. 10%, that's $90 billion. But here's what those experts aren't telling you. That's not a cost of doing business. That's a choice to prioritize speed over security, a choice to pay first and audit later, a choice to treat fraud as acceptable leakage instead of as the crime it is. Look at what happened during COVID-19. The government created the HRSA COVID-19 uninsured program to reimburse providers for testing and treating uninsured patients. Noble goal, critical need. But the program paid out billions with minimal verification. The result? The DOJ's own statistics show that HRSA-related fraud schemes account for more than $1 billion in fraudulent claims in the cases charged in 2024 and 2025 alone. That doesn't include the fraud that hasn't been detected yet. That doesn't include the schemes still under investigation. One case in the 2025 takedown involved a doctor who allegedly submitted $894 million in fraudulent claims to HRSA. Of that, $293 million was paid out before investigators caught on. Same doctor, same playbook as the Muhammad and Feroz case, different names, same crime. Critics also say, well, at least the government is recovering some of the money through seizures and prosecutions. True. The government seized approximately $100 million in assets in one related case, approximately $6 million in another. $245 million nationwide in the 2025 takedown. But compare that to the $14.6 billion in fraudulent claims. Recovery rate, less than 2%. The math doesn't work. For every dollar the government seizes, criminals stole 70 more. And here's the long-term calculation nobody wants to discuss. Every dollar stolen from Medicare is a dollar not available for legitimate health care. It's a dollar that could have paid for cancer treatment, cardiac surgery, diabetes management. It's a dollar that could have helped an elderly American afford their medications. But here's what nobody talks about: the human cost. Let's talk about the people this fraud actually hurt. Let's talk about the Medicare beneficiaries whose personal information was allegedly stolen and used to generate fraudulent claims. You're a 75-year-old retiree living on Social Security. You've got Medicare Part A and Part B. You've never heard of FZ Medical or Next Labs. You never visited their facilities. You never submitted a sample for COVID testing at their laboratories, but your name appears on their billing records. Your Medicare beneficiary identification number is on dozens of claims. Claims for tests you never received, claims for services you never knew existed. Now imagine you get a letter from Medicare, an explanation of benefits. It shows claims submitted in your name, tests performed, payments made. You're confused. You call Medicare's fraud hotline. You spend hours on the phone explaining that you never received these services. You're worried. Is someone stealing your identity? Will this affect your coverage? Will you be held responsible for fraudulent charges? Multiply that by thousands of beneficiaries. That's the human impact of healthcare fraud. It's not just about money stolen from the government. It's about real people whose medical records are compromised, whose identities are exploited, whose trust in the healthcare system is shattered. Acting Assistant Attorney General Matthew Gagliotti said it plainly. These defendants exploited the most vulnerable members of our society, the elderly and the disabled, for their own personal gain. That language is important. The elderly and disabled. These aren't abstract statistics. These are your grandparents, your parents, your neighbors, people who depend on Medicare, not just for healthcare, but for dignity, for security, for the peace of mind that comes from knowing that when they get sick, they'll be taken care of. Christian J. Schrank, Deputy Inspector General for Investigations at HHS, called the alleged fraud a staggering abuse of resources and a betrayal of public trust. In military terms, that's what we call understatement. This isn't just fraud. This is predatory criminal behavior targeting the most vulnerable Americans. But here's where things get complicated. Here's the complication. Muhammad and Feroz are presumed innocent. They haven't been convicted. They're facing charges, not sentences. Their attorneys will argue their case in federal court. They'll challenge the evidence. They'll cross-examine witnesses. They'll present their defense. That's the American justice system. Innocent until proven guilty beyond a reasonable doubt. But look at what's already happened. The government unsealed a superseding indictment. That means there was an earlier indictment, and prosecutors added more charges based on additional evidence they've gathered. That's significant. It suggests the investigation is ongoing, that prosecutors are building their case with additional evidence, additional witnesses, additional documents. The government has also seized assets, $100 million in one related case, $6 million in another. You don't seize assets unless a federal judge signs off on probable cause that those assets are connected to criminal activity. That's not a low bar. That requires evidence. Look at the charges themselves. 6 counts of healthcare fraud. That's not a single transaction. That's a pattern, a conspiracy. Multiple fraudulent claims over an extended period. 1 count of money laundering conspiracy. That requires proof that defendants agreed to transfer money with the intent to conceal its criminal origins. For Sufyan Feroz, there's the additional charge of engaging in monetary transactions using criminally derived property exceeding $10,000. That's a separate crime. It means prosecutors have evidence of specific transactions using money they believe came from the fraud. Now look at the maximum penalties. 70 years for Muhammad, 80 for Feroz. Those are the statutory maximums. Federal sentencing guidelines will determine actual sentences if they're convicted. But federal healthcare fraud prosecutions have a high conviction rate. Over 90% of cases that go to trial result in guilty verdicts. Most defendants plead guilty. And when it comes to pandemic-related fraud, the DOJ has made clear they're prioritizing these cases. Special Agent Douglas DePodesta's statement is telling. The FBI is committed to working with all our law enforcement and prosecutorial partners to ensure that anyone who dares to exploit government programs intended to assist the American people will be held fully accountable under federal law. That's not diplomatic language. That's a threat, a message to anyone thinking about committing healthcare fraud. We're coming for you. But is it right? Forget legal for a moment. Is it ethical that the government creates programs with minimal oversight, allows billions to be stolen, and then prosecutes individuals years later? Is it fair to defendants who saw an open door and walked through it? Those are uncomfortable questions, questions that don't have easy answers. So, is the enforcement action working? I'm going to show you the data that answers that question definitively. Yes, the crackdown is working, and I can prove it with numbers that even the government's critics can't dispute. Look at the year-over-year comparison. In 2024, the National Healthcare Fraud Takedown charged 193 defendants. Total fraudulent claims, $2.75 billion. In 2025, 324 defendants charged. Total fraudulent claims, $14.6 billion. That's a 68% increase in defendants charged, but it's a 430% increase in the dollar amount of fraud prosecuted. What does that tell you? It tells you that federal investigators are going after bigger cases, more sophisticated schemes, higher value targets. They're not just catching small-time operators billing for a few $1,000s in fraudulent claims. They're dismantling criminal enterprises that stole hundreds of millions. Look at the asset seizures. $245 million seized nationwide in the 2025 takedown alone. That's cash, cryptocurrency, luxury vehicles, real estate, gold. Those are assets that criminals can't use to fund future operations, assets that will be liquidated and returned to the Medicare Trust Fund. Look at the deterrent effect. The Healthcare Fraud Strike Force has now charged more than 5,800 defendants since its inception in March 2007. Those defendants collectively billed Medicare, Medicaid, and private insurers more than $30 billion. That's $30 billion in fraudulent claims that were identified, investigated, and prosecuted. How many potential fraudsters looked at those numbers and decided it wasn't worth the risk? How many criminal schemes were never launched because the architects knew the FBI was watching? FBI Special Agent DePodesta said it directly. Healthcare fraud affects everyone. It costs taxpayers millions of dollars, contributes to rising health insurance premiums, and depletes resources from our vital healthcare system. That's the message to criminals. We know what you're doing. We know how you're doing it. We're using data analytics, artificial intelligence, and good old-fashioned investigative work to catch you. And when we catch you, we're not offering plea deals to misdemeanors. We're seeking maximum sentences under federal law. So what happens next? This isn't ending. This is accelerating. The Department of Justice announced in August 2025 the launch of a new healthcare fraud data fusion center. This is a dedicated facility that uses advanced data analytics and artificial intelligence to identify fraud patterns in real time, not after the fraud happens, not during post-payment audits, in real time. The system analyzes billions of claims looking for anomalies that human auditors would never catch, labs billing for services at volumes that exceed their physical capacity, providers ordering tests that don't match their specialty, patients receiving services in multiple states simultaneously, geographic patterns that don't make sense. The system flags these anomalies for investigation. FBI agents and HHS investigators follow up. Search warrants get executed. Bank accounts get frozen. Indictments get filed. Attorney General Pamela Bondi made the administration's position clear. This administration will not tolerate criminals who line their pockets with taxpayer dollars while endangering the health and safety of our communities. The Healthcare Fraud Strike Force is now operating in 27 federal districts. 9 strike force teams working full-time on healthcare fraud prosecutions. Coordination between federal agencies that didn't exist 10 years ago. Real-time information sharing. Joint investigations. Simultaneous prosecutions across multiple jurisdictions. Criminals can't hide by operating across state lines anymore. The data follows them. The investigators follow them. Mohammed and Feroz allegedly operated laboratories in Illinois and California. The federal investigation crossed both state lines effortlessly, seized assets in multiple jurisdictions, built cases that linked activity in different states to a single criminal conspiracy. That's the future of healthcare fraud enforcement. No jurisdictional boundaries, no safe havens, no statute of limitations protecting criminals who think they got away with it 5 years ago. The government is coming, and they're just getting started. $293 million in fraudulent claims, $65 million stolen from Medicare, Medicaid, and private insurers. Two brothers from Naperville allegedly turned pandemic fear into personal profit. Gold bars, luxury mansions, high-end watches, all purchased with money that was supposed to provide COVID-19 testing to Americans who needed it most. Here's my message to anyone thinking about healthcare fraud. The FBI is watching. The Department of Health and Human Services Office of Inspector General is analyzing your billing patterns. The Healthcare Fraud Data Fusion Center is flagging your anomalies. And when they come for you, they're not offering deals. They're seeking decades in federal prison. To Medicare beneficiaries whose information might have been stolen, report suspicious activity immediately. Call Medicare's fraud hotline. Check your explanation of benefits. You are the first line of defense against criminals who exploit your identity. To American taxpayers, this is your money. $60 billion a year stolen from Medicare. $14.6 billion in just the schemes charged in 2025. Demand accountability. Support the investigators and prosecutors fighting to protect these programs. What do you think about pandemic fraud prosecutions? Should defendants who exploited COVID-19 relief programs face enhanced penalties? Should the government have implemented stronger verification systems before paying out billions in claims? Share this investigation because Americans need to understand the scope of healthcare fraud and the criminals who prey on our most vulnerable citizens. Stay informed, stay engaged, and stay vigilant.
CTV's W5.
So it's all very suspicious.
Hidden contraband leads to a nightmarish ordeal.
I feel like we're trapped in a cage here.
I don't know what they want. I don't know what they want.
And the long-detained accused face a dubious legal system.
They set things up so there aren't questions raised, and they did it very well.
These aren't drug smugglers. These are people who...
Naming you and your company, and I'm just wondering...
Vic Mander had nothing to say about why his numbered company in British Columbia would pay to fly what Trust Capital claimed were foreign real estate investors on a charter that was very close to returning to Canada with hundreds of kilos of cocaine. And this luxury villa in the Dominican, our research suggests that Vic Mander was involved in booking it. So what, if anything, did the passengers know? Rahul Nanda is the Canadian lawyer representing them.